Hello, Namaskar.
Namaskar, sir.
Namaskar. Speaking from Fortis Healthcare. I'm Dr. Bishnu Panigrahi. I work for medical strategy and operations for Fortis Healthcare. So it gives a lot of pleasure to introduce you to some of our top cardiologists across the country. And 29th of September is the World Heart Day. And this time the theme is Don't Miss a Beat. And so one of the things that are being propagated is that how do you promote awareness about heart health, prevention of cardiovascular diseases, and raise awareness on heart health. So with that, I'd like to introduce our panelist today, esteemed panelist Dr. Jaiswal. He's the director of cardiology at Fortis Mohali. In fact, that's our flagship hospital. He heads the cardiology department there. This is the hospital that started way back in 2001, and that is from where Fortis Healthcare has grown to be one of the largest and healthcare providers across the country. Uh, then we have Dr. Nitin Tripathi, who is in another director and head of cardiology at Shalimar Bagh. Shalimar Bagh is in Northwest Delhi, and in fact, that is the first hospital of Fortis in Delhi because Escorts was acquired, but the Greenfield Hospital of Fortis that came up first in Delhi was at Shalimar Bagh. So he is heading it, and the way the cardiology program has grown there, it's something commendable. The service that the public from that area are benefiting from the cardiology department of Shalimar is exemplary. We have Dr. Shubhanand Rai, who's again a director of cardiology at Fortis Hospital, Anandpur, Kolkata, which is, you must have heard about the last 2 days. It's the downpour that has happened. It has caused flooding and a lot of uneasiness there, and we had some disasters there. And then we have Dr. Gopi, who's a senior director also at Cunningham Road facility, which is at Bangalore. And in fact, to do the history of Cunningham Road, that was earlier the first heart hospital of then Bangalore, now Bangalore. Called, that was at a time called Wokhad Heart Institute, which was acquired in the early 90s, 2000s. And then we have Dr. Sharma, who's the newest hospital of Fortis Healthcare. It is in Jalandhar, and he's a renowned cardiologist of Punjab. We'll be hearing from him. And then, as I said, that Dr. Sai, he's, put it lightly, the new kid on the block, if you can put it, in the Fortis family. He's the director of cardiac sciences at the senior intervention cardiologist at Gleneagles, Trivandrum, sorry, Hyderabad, and that is called Lakdi Ka Pool, if I'm not mistaken, the area that is there. And it is in fact the earlier global hospital, the first hospital of the global chain later acquired by IHH, and now IHH renamed as Gleneagles. And just for everyone's knowledge, that Gleneagles is now being managed by Fortis Healthcare. So that's how we, when I was there last week at Hyderabad, met him. He's one of the topmost cardiologists of Hyderabad, young, energetic, dynamic. So I requested him that we have this World Heart Day session. So if you could join, it would be great to hear him and take his valuable advice for the public at large. So, Tripathi, how does uncontrolled high blood pressure silently damage arteries and lead to blockages? Just for the common man, because blood pressure is one part of it, and coronary disease is another part of it. So, is there any
Yes, sir.
linkage there? What is the message that you should give to the public?
So that is a very relevant question because almost 95% of the times hypertension is asymptomatic. It does not give any symptom. But when arteries are getting ejected with a high pressures, that is high with high blood pressure, blood is flowing in the arteries, that is damaging the arteries in a microscopic way. When there is a microscopic damage to the endothelium of the arteries, the body tries to repair it, and when repair happens, it happens with the fat and cholesterol. So there is a gradual uh, loss of stiffness of the artery, and there is a deposition of cholesterol and fat, which forms a streak which grows into a larger plaque. When that plaque grows larger, and when there is a rupture of the plaque, the heart attack happens. So it's not only heart which is getting damaged in the arteries which is blood supplying to the heart, but in fact high BP is damaging arteries in every part of the body. Therefore, when damage happens in the brain, the stroke might ensue. When damage happens in our eyes arteries, then blindness happens. When damage happens in our heart, then the heart attack happens. And when it is in kidneys, then kidney failure ensues.
Okay, thank you. Dr. Sharma,
Yes.
so welcome on board to Fortis Healthcare. And so my question to you is that to the public is that why is smoking harmful for the heart? How does it impact? How does exposure to air pollution or poor quality air influence the development of the harmful effects of
Yeah,
smoking
that
on
is
the
a very relevant. That is very, very relevant. Actually, in heart disease, we recognize high blood pressure, diabetes, overweight, and cholesterol. But somehow, very important factor, one very strong factor, is smoking, which is not being so well recognized or well connected with the heart disease. Smoking has been connected very well to the lung cancers, but its impact on the heart disease is somehow not so well being known in the public. And it is important to make the people aware that smoking is as injurious to heart as any other risk factor like cholesterol or high blood pressure is. How does smoking affect the heart? It is smoking basically increases our heart rate, heartbeat. It increases our high blood pressure. It increases the overall load of the heart. Once the heart rate is high, blood pressure is high, the heart has to work more. It requires more oxygen, so it produces damages the heart ultimately. And the important factor in smoking is that it releases, so we call them as free radicals in the blood. Free radicals you can compare as like more as a point mans in any gang wars which we have, that they are the main shooters. So free radicals are something like that. They are in the blood, more act like a shooters. They damage all the endothelial, we call it endothelial. That is a lining of the cell which lines the blood vessels. So blood vessels, that lining is very, very important. It protects us, our arteries, from getting blocked. Once that cell line is damaged, so the arteries get more and more deposition of cholesterol in their vessels. So that's they become choked basically. So to make public aware about side effects related to heart, it is very, very important. So today is a good day to make people aware of that. And same way, air pollution also. We have the so many pollutants which also acts near about similarly. They all produce free radicals, and their free radicals are damaging our blood vessels. So more and more cholesterol goes with the arteries, so they get choked very easily and in very early stage.
thank you. Dr. Roy, are you?
Yeah, am I audible now?
Yeah, thanks. So,
Yeah.
so welcome on board.
So,
The question was that can poorly managed diabetes speed up the formation of heart blockages, even if cholesterol levels are normal? And how does excess weight add to this risk?
yes, sir. But basically, the most important guidelines released recently is the ESC guidelines 2025 for prevention of heart disease. And it showed that there is a score called score 2. And that score 2 includes the obesity, though it did not mention about the diabetes, but we all know that diabetes, if diabetes is present, and particularly poorly controlled diabetes is present, it is almost an ischemic heart disease equivalent. So, particularly in obesity in a patient, and if he has a diabetes and also premature disease history in the family, these are the very high risk factors for coronary artery disease. If they are present, the risk factor for coronary artery disease is more than 20%, and they can lead to early coronary artery disease. Now, how diabetes increases coronary artery disease? We all know that diabetes not only produces excess sugar, but it is also contributes to the damage of the endothelial cells by producing less amount of nitric oxide, as sir was talking right before me, that the smoking also does the same by damaging the endothelial cells. And as because diabetes can cause low nitric oxide production from the endothelial cells, the cholesterol particles become deposited inside the coronary arteries and can lead to coronary artery disease. And we also, if there is a plaque in the coronary artery, poorly controlled diabetes can cause plaque erosion and plaque rupture. So these are the points should be remembered very importantly, that if there is a diabetes, it can cause genesis of ischemic heart disease. And if there is ischemic heart disease and a poorly controlled diabetes, that can precipitate an event, as for example, heart attack or a cardiac arrest in presence of poorly controlled diabetes.
Thank you. Dr. Sudhakar, I'll come to you now. Is that a couple of things I'd like to ask is that since Dr. Jaiswal also is not there, just want to ask is that are there specific warning signs during physical activity that indicate a blockage is developing?
So I'm not able to hear your question.
Okay, I'll just come to. Okay, I'll come to the next one. Is that how? Can you hear me now? How does excessive alcohol intake impact the arteries and increase blockage risk over time? Because there's a misconception about alcohol.
Yeah. Hello. Yeah. Sir, hello, everybody. I'm Dr. Sai Siddhartha from Hyderabad. So, most of the people, the word you used, excessive alcohol. So, I feel that alcohol is not essential for health. So, if somebody drinks, it should be in limits. But somebody who doesn't drink, it is better not to start. So, there is no medical benefit for alcohol. But when coming to about excessive alcohol, as rightly said by Dr. Tripathi sir and other panelists, other doctors who have mentioned, there is a sequence of cascade of events usually happen when there is a persistent and frequent consumption of excessive alcohol. There is no safe limit anywhere decided for alcohol. So this most important thing is I just try to explain in 4 different steps. One is there's an increase in blood pressure. When there's a regular intake of an excessive alcohol, there is a vasoconstriction, activation of sympathetic system, where there's an obstruction and causing the high increase of blood pressure. With high increase of blood pressure, as the previous panelist was taking, there is some endothelial dysfunction. Endothelial dysfunction is this endothelium. What is the endothelium dysfunction? It acts like in South India, or we usually have dosas. There is a Teflon coating on the pans, non-stick pan. So it acts as a coating in the cells. When there is endothelium dysfunction because of inflammation or any other disease, these cholesterol, vascular particles act and stick to the arteries, making a clog or blockage in the arteries. And excessive alcohol also alters with the platelet function, causes excessive production of fibrinogen and clogging the artery. Like if I take an analogy, for example, there's a clean water flowing in a pipe. This excessive alcohol acts like a dirt and grease into the free flowing water. Then there is no Teflon coating, there is endothelial dysfunction. This dirt and other particles start sticking to the walls of the arteries. When they start sticking, they slowly narrow the artery. The flow of the blood vessel is limited. Now there is a platelet dysfunction and there is a big clot or stone stop the entire pipe, and there is a stoppage of flow to the brain and heart, causing stroke. So excessive drinking with this mechanism is one of the important cause for the stroke and heart diseases. So I say there is no limit. Though some guidelines say that red wine is good and some wine is good, but instead of consuming wine, there is other healthy habits to increase your HDL levels.
Thank you. Very well captured. So, Dr. Tripathi, I'll just come to you. Is that what role does maintaining a healthy weight play in keeping arteries clear? Is there a direct correlation between weight and blocked arteries?
Yes, sir. I think this is most relevant question, and this question is coming in at the time when, in India, obesity is becoming pandemic. Our kids and young adults are like getting obese. When I will emphasize, controlling the obesity or maintaining the appropriate weight will help a person in multiple ways. If weight is reduced to the ideal level, LDL, which is bad cholesterol, reduces. HDL, which is good cholesterol, it increases. By decreasing the weight, since high weight is related to chronic inflammation, chronic inflammatory markers do decrease. And when they do decrease, it not only decreases the chances of heart attack and stroke, but it benefits in a multiple way as well. We know that decrease in the weight is going to decrease the high BP by at least 10 to 15 millimeters of mercury systolic and 5 millimeters of mercury diastolic. It's like equivalent to taking the antihypertensive medicines. So it's going to normalize the weight. If a person normalizes the weight, the BP normalizes as well. Then there is a diabetes. When weight is increased, so there is a insulin resistance and person becomes diabetic. When weight comes down, the diabetes control is better, and even the medicines might not be required in certain cases. The person becomes more energetic, and so controlling the normal weight helps in a multiple way. It improves your activity, improves your appearance, improves your BP, improves your sugar, improves your lifespan, and decreases the chances of getting heart attack, stroke, and many more things. Thank you.
Thank you. Dr. Jaiswal, are you able to hear me now? Dr. Jaiswal? Glitch. So, Dr. Sharma, I'll just come to you then till we sort that out. Is that taking from Dr. Tripathi's thing on the weight part of what role does physical fitness have, and beyond just weight control, to help keep our arteries healthy? Does physical fitness have a role to play in keeping our weight under control, and does that have a effect on the arteries?
We all know that the main culprit of recent increase in sugar, blood pressure, heart disease is basically lack of physical activity. We all know it basically, and day by day, all these disease increases by the introduction of rapid industrialization. So main thing which affected was our physical activities. Slowly we start reducing our physical activity, and today if we see there is hardly any physical activity left in our daily life, is a very strong contributor to our increase in cardiovascular disease, so-called heart diseases, blood pressure disease. Physical activity is must for us. It is just like we take food regularly. So physical activity just can be taken as equivalent to our food, which we take every day regularly, and it maintains our well-being, not only in the physical strength but mental stress also. It maintains our hormonal balances. we get so-called insulin resistance. Away from insulin resistance, the whole metabolic disorder which we normally are prone because of inactivity, and which is supposed to be the main reason behind all our heart diseases, is getting basically controlled. So physical activity reduces our weight, as has been highlighted, helps in maintaining our weight. An important aspect is it regulates our insulin metabolism also. So it increases our energy uptake by the muscles. So when the energy uptake by the muscles is increased, we call it as a insulin resistance stage is over. So our blood vessels remain healthy because insulin is very deleterious for our blood vessels. Once the insulin uptake starts working in the peripheries, our so-called as endothelium, it becomes healthy, and we get less of the blockages. Also, physical activity removes our mental stress also. Mental stress is an important factor which is not being still considered in our health parameters. So it reduces our mental stress, and by that again it makes our heart healthy and all our blood vessels healthy.
Thank you. Dr. Sudhakar, coming to you is that because there's a lot of connect between family history and coronary artery disease. So, is there any message that you would like to give to the public at large as someone with a strong family history of heart disease? What proactive screenings should start early?
Actually, the family histories are very, very important. Also highlighted by the recent guidelines that if the patient has got if the person has got a family history of premature coronary artery disease less than 50 years, he should be considered as a high risk patient, a person. So we know that the atherosclerotic lesions start, atherosclerotic patches start early in the first decade. And then it takes a long time to become advanced atherosclerosis and complicated atherosclerosis. And by after 20 to 30 years, depending on the risk factor modification, it becomes manifested as ischemic heart disease. Now the problem is, some people are if some people having a very high family history of ischemic heart disease, I think the ideal screening should be done in the early childhood, maybe in the first decade, and then after that we would be able to know whether he is having a dangerous disease like homozygous type 2A hyperlipidemia, where the LDL cholesterol becomes very high and the premature atherosclerosis develops and heart attack develops even in the second decade. So these are the patients which should be screened early, and also not only these patients but also those patients who have early family history of ischemic heart disease should be monitored for other risk factors like childhood obesity, childhood diabetes, childhood hypertension. So these are also very important to reduce the atherosclerotic burden and atherosclerotic event in the later life. So screening for heart disease and screening for ischemic heart disease should be started early in life in patients who have positive family history.
Dr. Sudhakar, just on the taking off from that, how important is regular lipid profiling for people who otherwise appear to be healthy? So, is there some message that you want to give across?
Yeah, sir, that is what the regular. Otherwise, like sir was talking about family history, the family history should always be taken as a clue for future heart diseases. So it is very important. Nowadays, we are seeing the people with heart attacks in young. There was an important topic called stroke in young. People who are usually the people who get in heart attacks, suffer coronary artery disease, are divided in two groups: the risk factors which are modifiable and which are non-modifiable risk factors. So the other risk factors like smoking, diabetes, hypertension, lipids, these are the major risk factors which can be modified risk factors. So apart from protein lipid profiles, there are new proteins like lipoprotein A and lipoprotein AB, which are the protein which are transporting fat, transporting proteins. There are the other important tests which can be done apart from the routine lipid tests, which they help in screening the younger population. People think that only if my lipids are normal, I am fairly healthy, I'm okay, I'm away from the risk factors. But apart from this, there are certain other risk factors like family history, which is very important, which is determined by certain factors, and apart from family, which cannot be changed, which is genetic, age cannot be changed, gender cannot be changed. So lipid profile alone doesn't make an important factor on getting a coronary artery disease, but factor contributes one of the important factor which is useful in identifying the coronary artery disease. But keeping lipids under control is very important. Like LDL and triglycerides are known to be the bad cholesterols, and HDL has to be a good cholesterol. Keeping them in check is one of the way to have your risk factors under control.
Thank you. Dr. Jaiswal, am I audible?
Am I audible now? Am I
Yeah.
audible now?
Yeah. So just coming over to you now. Sorry for all the glitches. So one is that just for the common man out listening this, is that what are the cardiovascular diseases that are prevalent, and what are the symptoms, and how does a common man identify it?
See, cardiovascular disease is a very broad spectrum. You know, one can have congenital heart disease, one can have myopathies, pericardial disease. But what we are trying to focus today is atherosclerotic cardiovascular disease. So atherosclerotic cardiovascular disease means what we have written here also, one blockage, many causes. So that this is something which blocks the arteries of the patient. Arteries are the vessels which are supplying the blood to the heart muscle. And once these arteries, they start getting blocked, the flow to the heart muscle starts decreasing. And this process starts very early in life. That's why people say that the prevention of heart disease should start from very early age group. And you see, once the arteries are blocked, one starts experiencing some exertional symptoms initially. When they walk, they can have some feeling of pressure in the chest, heaviness in the chest, sometimes, a feeling of constriction, or a feeling of, tight rope around the chest. Or it can be just a feeling of heaviness, which means some people feel that there is a heavy weight which is lying on the chest. And contrary to common belief, which people normally think that the pain would happen or discomfort will happen on the left side because the heart lies on the left side, that's not so. It mostly starts from the center of the chest, and it is a diffuse feeling. It's very difficult for the patient to pinpoint that the pain is located here. And from there, that central part, it tends to spread to both sides. Left side is more than left, right? And also sometimes it leads to choking in the throat or pressure feeling at the backs also sometimes near the scapulae, which are called the wing bones. In fact, any discomfort which happens between umbilicus and lower jaw can be related to heart disease. And once the blockage starts becoming more than 90%, then people tend to have these symptoms even at rest or on minimal exertion. And if it worsens all of a sudden, that is called unstable angina. And when there is, as already mentioned also, there is rupture of the plaque and suddenly clot is formed, that leads to complete occlusion of the artery, and that's the time when heart attack occurs. So it is very important to recognize the early symptoms so that, before the arterial blockage becomes critical and it leads to a cardiac emergency, what we call as the heart attack, the patient should be aware, he should look for help, because forewarned is forearmed. So nowadays the strategy is attack the heart attack, don't let it come. If it comes, it is going to damage heart muscle, it's going to kill people. But if we recognize and find a solution for this problem beforehand, then it is as good as a old lump lying inside your arteries, which can be handled and the lives can be saved. But it is also important to know that sometimes the patient may not have any symptoms at all or may have minimal angina equivalents like dyspnea on exertion, or sometimes the patient may complain of just ghabrahat, undue sweating, or sometimes just gastritis like symptoms, particularly if the lower side of the heart, what we call as the inferior wall myocardial infarction happens, then these people have predominantly gastric symptoms. They keep confusing with the gastric symptoms, and by the time they reach the hospital, they are already critically ill. So these all subtle signs have to be, you know, closely watched, and if any of these symptoms are there, then we must seek help, because if a heart disease or heart attack happens, then it's like a heart on fire. So every minute you are losing heart muscle, there is risk to your life. The fire has to be extinguished quickly. So early diagnosis and early treatment is very, very important. That's why it is important to recognize the symptoms. And that is the whole purpose of today's, I think, this discussion, so that we can make more people aware that they find out the problem earlier. There are certain angiographic findings which have clearly shown that up to 68% of the patients who have proven coronary artery disease on coronary angiogram may have minimal or unnoticeable symptoms. So unless we are watchful, we may miss out in 2/3 of the cases. So I would advise everyone to be watchful about these symptoms, and if any of these symptoms are there, keep a very low threshold for investigation, find it out what it is, and that's the way forward.
Thank you. Dr. Shubhananda, I want to ask you is that like sleep patterns, night shifts, does it have an effect on the heart? And
Sleep.
yes.
Yeah, basically, we know that nowadays there is a new syndrome which has come up for the recent years. There is a sleep apnea syndrome, and also disturbed sleep. We know that stress is a very important factor for ischemic heart disease, and also the stress is considered as one of the risk factors and one of the scores that build up risk factor for premature coronary artery disease. Even in sleep apnea, and stress is related. Disturbed sleep is related to stress. There is no doubt in it. But sleep apnea is also a definite term which can give rise to low, hypoxia or low oxygen during the sleep, and that can cause cardiac arrhythmias and also can precipitate a cardiac attack during the sleep. And so these sleep apnea also has got an effect on the blood vessels, particularly the lung blood vessels. But when there is a low oxygen tension, the lung blood vessels are constricted. They give rise to pulmonary hypertension and actually give rise to high blood pressure even also. So these are the factors, that is a disturbed sleep or sleep apnea syndrome may be related to the definite coronary artery events, though it is not proved that whether it can produce coronary artery disease, but it can definitely produce an event and a lot of arrhythmias and cardiac arrest during sleep. So sleep can be a very important factor.
Thank you. Dr. Sudhakar, in fact, some recent studies also have shown that since now we're talking about Vikshit Bharat, our demographic dividend, and it is this young workforce which will drive us there. But a lot of youngsters are being seen to have high blood pressure, and often it is not picked up. And later on, they have been found that they are the ones who have a high incidence of cardiovascular events. So, what is the message that you would like to give to the public, the parents, on what they should be looking at to see that the younger, I'm talking about school-going children, college-going kids, they are looked after properly so that we don't miss out on a high blood pressure and we have a unnecessary event when they are in the middle age.
whenever we are taught medicine and when we are learning through going through various guidelines, when we see a blood pressure, whatever different hypertensive guidelines we come through, all the doctors in the world come through, one point immediately we see is when the blood pressure is 140 by 90, the first thing what we suggest is lifestyle modification before going to the drug therapy. So if you see the most of the youngsters, whatever is happening, we are seeing young hypertensives and most important things. It is mainly attributed to the lifestyle. The lifestyle is very important. When you come to the family history also, the three important factors which influence this, the environment in which the family is growing. But they're more used to sedentary lifestyle. Are they more used to normal instead of walking or more sedentary because the systems have come work from home. People used to park the cars and walk to the houses or use the stairs. They started working from the more of sedentary lifestyle. So lifestyle is a very important part, which has become a very important thing in the younger generation, which is not being accepted. So these younger generation, the kids, the lifestyle includes the dietary pattern which they're having, the exercise. For example, the sedentary lifestyle. Routine activities all needs to be incorporated into their activities. This is a major important factor which is causing the hypertension in the end.
Thank you. So we'll go to end our thing, but I would like to ask each one of you all to give some take-home messages to the public, because this year's theme is don't miss a beat, and the three main points that they are looking at is that awareness, how to enhance awareness about heart health, prevention of cardiovascular diseases, and raise heart health awareness. So, if one could, because you all come from different geographies, so it will be a take-home message for the people who are listening to you. So, I'll start off with Dr. Sharma, and then I'll come around. Dr. Sharma, quickly.
Cardiovascular disease is basically synonymous with lifestyle disease actually. So the most important thing to prevent heart disease is always a change in the lifestyle. And as I covered, basically smoking and physical activity or mental stress. They are the things which has not been recognized well in the society as being linked to the heart attack. So I think the need should be to emphasize the role of quit smoking, and to be aware of their mental health by taking care of stress. As we know, stress is being increasingly being added to the workplace, at our home also. So they should be considering some help to reduce the stress. So most important thing from my side will be to make aware about the factors which has not been so well recognized in the society still: smoking, physical activity, and stress.
Okay, thank you. Dr. Jaiswal, any take-home message from your side?
Yeah, I think there are three major components Dr. B.P. Sharma has already talked about. That is healthy lifestyle. Coronary artery disease is a disease of unhealthy lifestyle. So only way to prevent it is by adopting a healthy lifestyle. We are short of time. I'll just tell 4 points. Regular exercise, healthy food. Without going into much discussions, I would suggest you go to net and find out what is the Mediterranean diet. That's a heart healthy diet. Third thing is avoid consumption of tobacco in any form. In every form, tobacco is harmful for heart. Fourth is stress management by yoga, by meditation, by devotional music, and even by attitude change. Never be in a hurry. So the basic thing is Bhagavad Gita says, he who on this earth can withstand the storm of desire and anger is a yogi, is a healthy man. So if you want to adopt healthy lifestyle, so anger and desire both have to be curtailed as far as possible. Second is recognize the preventable risk factors: diabetes, hypertension, smoking, your central obesity. All these factors, they contribute to heart attack later years. Like even for lipid profile, it is the lipid years which are more important than the absolute values. So the earlier it is corrected, the better it is. So very early screening for these risk factors in every individual and correction of these factors before it causes harm to the heart. And as I said, watch your waistline. Waistline and lifeline are inversely related to each other. More the waistline, less the lifeline. So
Thank
keep
you.
your tummy flat. And that for Southeast Asians, a man with the waist circumference of more than 36 inches and females with waist circumference of more than 32 inches, they justify or they suffice the major criteria for metabolic syndrome, which is rampant in our country. 40% of adults have metabolic syndrome, and those who have metabolic syndrome, they have 2 to 3 times higher incidence of blockage of arteries everywhere, whether it is heart, brain, or peripheral vessels. So watch your waistline, adopt healthy lifestyle, and third and most important part is screen for the modifiable risk factors and correct them as early as possible.
Thank you. Party? Yes.
Uh, Thank you, sir. Esteemed panelists have covered almost everything, and I will repeat only: stop smoking. Passive smoking is equally harmful. So if you are smoking, it's not only you; you are harming your family and your colleagues equally. Second thing is diet and exercise. Emphasize more than enough. Third thing is this: watch the risk factors. Is also emphasized more than enough. Fourth thing I will add: do get trained in CPR. Some of my patients have brought their families, their relatives, by doing CPR, and patient went home alive. That saves the life. And in fact, the person who is attending first is near the patient is going to help the patient, and it's not the doctor, and it is the patient or relative who has helped him has saved the life in first go. So I will uh, request and I will like emphasize that every society should organize a basic training of CPR. That is my message for this.
Thank you. Sudhakar, any take-home message for
So
your
I think all the panelists have covered everything. So one message stands out clearly. So the theme for this year, don't miss a heartbeat. And one message stands out clearly is prevention saves lives. So don't wait for symptoms. Check your heart before your heart starts talking. Every heartbeat counts. So screening matters. So screening is a very important part which every Indian, every person should go ahead and know. Everybody should know their numbers. So the baseline numbers, the basic blood pressures, cholesterols, sugar levels, check them regularly, periodically, yearly, as and when required. Small lifestyle changes, I think, today will prevent big heart problems tomorrow. So in current generation, like I said, small lifestyle change, small lifestyle. Just walk from your office to the car. Walk, use stairs in your working area. Walk back to the home. Small lifestyle changes, and finally, a healthy heart, a healthy life. Must we should always act and thrive, and that is a very important message we all cardiologists try to give to the public, so they live happily and make their family happy. That's very important.
thank you. Dr. Subhanan Roy?
Uh, so everybody has covered the major points and so if I repeat them, that will be again a lot of repetition. But I must say that we are talking about lifestyle modification and everything in an adult, but it should be started very early in the childhood. So if we really want to build a nation with little heart disease or controlled heart disease or without heart disease, we should be act very early, even in the childhood. A child in the school should give lifestyle modification like regular walk, exercise, play, and balance between the routine and the play, and also heart healthy diets, so that his body weight becomes normal, his exercise habits grow, and he becomes lean. All these lifestyle modifications should be, and also the proper screening of the children should be done if they have family history of ischemic heart disease and all. These should be started early. Otherwise, we cannot make a good nation.
I want to first thank you all the panelists. I think it was very informative. The public at large also will be very happy to hear all this. So I think the basic message is that start early, and as rightly said, if you have your checkups on time, you can pick up things much earlier, so you don't miss a beat. And as they say that was told by one of the panelists also, don't allow your dil jalne se pehle. If you check it up, you are in the right phase. And I must commend Dr. Shubhanan Roy also on mentioning this. I think so. It should start at the early age. Start at schools and colleges. That is where the education has to happen. To see that they are physically active, the play. And one important thing which I would like to pass on to society at large is that we don't have playing areas for kids. The urban thing, we are becoming too urbanized, and there's no one keeping a field there, a park there for a place to. We can have statues for political leaders, but we are not looking at a entertainment park or a playing ground for them. I think so. This is something that, if it is done, it will keep people active and help us be that for the 2027, 2047, the Viksit Bharat will be the right space, because health and education is something that will drive us forward. Thank you, everyone. And again, a great thank you to all the panelists. Namaskar.
Thank you.